Okay, so what are we gonna do when a patient is short of breath?
Notify the nurse.
Correct, we're notifying the nurse.
Okay, would you say that if that's an option on your question, that's the right answer every single time?
No.
Almost.
I would think it's a safe bet, but depends.
Maybe like the fire room.
Let's just go through the
C.
whole, let's
It's
go
D.
through the whole
C.
test.
It's C.
That one's easy.
Yeah.
Oh.
When collecting a multi-draw,
I
Median.
picked median cubital,
Median cubital.
cause that's where you start, right?
always,
Alright.
always. PCT is caring for someone who has end-stage pancreatic. They express concern because the patient has refused admission to hospice.
The nurse.
I'd say acknowledge and tell them to notify the nurse.
Family's concern.
Cause I ain't gotta do shit.
Cause you can't you can't.
You can't tell.
Yo, you got 6 weeks
That's
left.
out of our scope.
So I can encourage them
Yeah.
as a PCT, right? To tell the patient that treatment's not an option, that nope, that's not me.
Yeah.
Recommend alternative options, also not me. I
But
don't
I
practice
picked the
medicine.
good
Yeah.
box.
So acknowledge and notify.
You got 6 weeks left to recommend the box.
Left arm, okay.
This one's hard.
Oh yeah, that one.
Was it the
That's
deltoid
that,
one?
bit. Damn.
Okay. So my problem with this question is that it doesn't tell you where the arm has been amputated at, okay? So it's obviously not right sternal border, okay? It's not anterior axillary, okay? Would we put it on the actual amputation site?
We don't even know where it is.
No, because it could be up here, it could be down here. Not to mention that amputation site is going to have scar tissue. Scar tissue is not a good conductor of electricity. So the appropriate spot would be left deltoid. A sputum specimen?
Thick.
They consistency. It's asking for what it's gonna look like.
Okay. If it's watery, what is it?
Saliva.
It's saliva.
I
Yeah.
heard, okay, it is.
Wouldn't it
Yes.
also be yellow, kind of yellowy, if it had like mucus?
But we don't know.
That's true.
We
It
don't
could be
know.
different for each patient.
Okay, we don't know. It could be pink tinge, it could be yellow, it could be all colors of the rainbow,
Oh.
right?
That's what I was
But that's not what we're looking for. We're looking at what would we expect, and we're expecting a thick consistency. Recognize that which of the following statements regarding skin prep for blood cultures is correct.
Chlorhexidine.
The chlorhexidine?
Chlorhexidine.
Chlorhexidine, okay. Sterile saline, is that gonna help anything?
No.
No, that's just sterile salt water.
That's a good one.
EKG has a pacemaker. Which of the following controls should be adjusted to ensure an accurate EKG?
Artifact?
The artifact.
I said artifact. I really didn't know. I tried looking this one up.
I said artifact.
Heart rate.
Maybe artifact,
Like after.
because what is the artifact filter going to do?
Get rid of extra stuff.
Get rid of the artifact.
Any
Get rid
electrical.
of anything that you don't want it to be there, right? It's why you put a filter on your face when you take a picture. It gets rid of, it smooths everything out, right? Makes it look pretty. Okay, so that's what we want. What's gonna happen with the pacemaker? What's gonna show up on the tracing?
An extra heart.
A spike.
The spikes. The spikes. Ostomy care.
I said red in color.
You know, I said that.
Oh wait, no,
Bloody
report.
drainage.
I said
Bloody drainage.
yeah, bloody drainage. Never mind.
I think bloody drainage.
Or the
Yeah,
wafer.
bloody drainage.
Yes.
Red and
'Cause
color is
it-
good because it needs to stay like.
Yeah,
nice
it needs to
and-
be red. The stoma should be
It can't be
red,
white or
right?
nothing like that.
We don't want it to be pale, we don't want it to be white, okay? Do we want it to stay the same size?
Yeah.
Yes. Leaking around the wafer,
That might be normal.
That's
I
normal.
mean, yes, that's an issue, but this one's more of an issue. Okay, bloody drainage, it should not be bloody.
Let's see.
12 lead, to be evaluated for chest pain. What, should you do if the patient says they are afraid?
A?
Yeah.
I did.
No,
I said painless.
Oh yeah.
We gonna put these electrodes in your mouth and we gonna electrocute your ass.
Alright, does jewelry cause sparks?
No.
No. Can we tell the patient that they don't have the right to refuse?
No.
No. Are we gonna get them completely naked?
No.
No. Is it a painless procedure?
Yes.
Yes.
Except for the stickies.
You're reinforcing teaching with a patient who has a Holter monitor.
Avoid adjusting the electrodes when monitoring. period.
Yeah, that's what I picked.
Instead of shower,
See?
but also this is not my strong suit.
Okay. So what is a Holter monitor?
It's
It's
that thing that
like
stays with you.
EKG. It's
It's
like
a portable EKG.
Like a purse.
Yeah, it's a portable EKG that goes with the patient. We're monitoring the patient for at least a full 24 hours,
they
okay?
get a diary.
So, should I have them take the wires off at night?
No.
No. Should they put that piece of electronic stuff in the tub with them?
No.
Okay. Avoid adjusting the electrodes during the monitoring period,
Yeah.
maybe. Set the time on the digital clock at the beginning of the monitoring period.
I don't know.
Why would I do that?
I feel
I
like it's
have
just
it on.
extra.
Am I going to do that, or am I going to have the patient do that?
Yes.
I'm going to do
You're gonna
that.
do that.
I set the clock. I'm gonna put the batteries in it. I'm gonna set the clock. I'm gonna make sure that everything is good to go, so the patient doesn't have to. So I'm going to tell the patient to avoid adjusting the electrodes, okay? Because it says I'm reinforcing teaching with the patient. This is my job. This is the patient's job. PCT is transporting a patient using a wheelchair. Which of the following actions should the technician take?
I put
I got
A.
distracted. Hold on.
make sure the footrest.
There was a cowboy on my screen. I got distracted.
Oh.
Okay, yeah, you, yeah.
I don't even know why I'm talking. Can't even read it up there. Can't see.
I think, I don't know.
I picked
all good
A.
ones.
I said A. Cause fuck the blanket. I don't remember there being a belt.
Oh yeah, I'm gonna miss you the most.
And then like I thought miss okay, so pulling the back wheels is only when we're like necessarily going up a bump.
Yeah, but
So-
pulling the back wheels up, the patient's
Oh,
sitting
yeah.
in it.
We're gonna fall out.
Well, yeah, but the patient's sitting in it. Are you gonna lift that patient?
No.
Maybe if it's a
Depends how heavy they are.
Yeah.
Use a lion.
And so, it is going to be, make sure their feet are on the footrest.
Yeah.
I think I picked that.
24-hour post-op following a total hip and a surgical wound. Which of the following should the technician identify as the indication of potential wound infection?
Warmth
St.
around the
Grenius
incision
danger
site.
drainage.
Sarah saying.
I put the
Sarah
last
saying
one.
drainage.
Cause you're saying this, that's kind of normal, especially after surgery.
Right?
Yeah.
I thought Ciro Sanguius was like the nasty one.
That's the sanguineous one. No, the other one is percutaneous.
What are your signs of an infection?
Yeah,
Warm,
'cause-
red.
Inflammation, right? So it's red, it's warm, it's swollen, it's draining, something gross. Okay, so serous sanguinous at 24 hours post-op, is that expected?
Yes.
Yes.
Okay, are they gonna be hurting?
Yep.
Yes. Is this temperature normal?
Yep.
Yes. It's hot around the incision site.
Not okay.
Not normal. That's
Okay,
the signs
good to
of
know.
infection. A PCT is preparing a patient for hospital discharge. The patient says, I'm afraid to go back home to my partner.
I
Which of
think
the
that's
following
no.
is appropriate?
I said
I said A.
I said can
Yeah.
Yeah,
Because I
no,
like
okay.
going to a police
I
officer
first
right away.
picked A and then I changed it.
I want this B.
Yeah, I
What?
chose D. Like, oh, like, do you want to talk
I
about
think
it?
it's A or D. I was
Because why would I immediately like want to like be like, damn, like they hitting you, like
Because
let's
they
call
could
the
talk
police.
to police anytime.
Yeah.
Because aren't we like a mandated reporter or something?
It's D.
It's D.
Oh.
Alright,
Yay.
we don't, is it, or are we gonna go straight to an officer?
Mm-mm.
No, we have to do what first?
Nurse and charge nurse
We
and all
have to
that.
go our chain of command, okay? Could it potentially end up with an officer?
Yeah.
Yes, but are we gonna be initiating that?
No.
Okay. If your partner is abusing you at home, would you tell me immediately?
No.
Right? Okay. Your partner loves you. There's no reason to be afraid.
That's just invalidating.
Okay. So I'm afraid to go back home to my partner. Okay. We don't know why. Is it because their partner has really bad breath? Okay, is it because they have 1,000 cats that they can't get rid of, or is it because there's something that makes you feel unsafe? I need a little bit more details, okay? To say that I'm afraid to go back home to my partner doesn't necessarily mean that we're talking about abuse, right? We don't know that, we can't assume that. We need to figure out, is there a reason? Maybe,
Lydia.
you never know. I literally used to work with a nurse that had a husband with really, really bad breath. She could not stand being in the car with him.
Now, why would you marry them?
Divorce.
Or just tell him to brush his
That was
teeth.
because he ended up going to prison for a couple of years,
Oh.
and then he got out, and he had like horrendous breath.
My goodness.
Divorce that.
Yeah, they, eventually they did. Not because of breath, but because of other things. So, all right. Oh, here we go.
Yes. Apply the gate belt
Over
over
the
the patient clothing and
Yeah.
the waist.
I picked
Yeah.
E.
Over clothes.
All right. So,
Oh.
which of the following actions should you take? Walk on the patient's stronger side while ambulating.
No. Because
Okay.
they got their
Maybe.
stronger side.
Yeah. Okay. Walk slightly in front.
No.
No. Apply the gait belt over the patient's clothing at the waist.
Yes.
Yes, 100%. And grasp the gait belt on each side with the palms facing down.
No.
No. Remember, you guys would like put your hands in like this, and I would say no, you have to go under. You have to go under. So yeah, so this one is this.
I did that one last time.
That's the thing about the fucking, what's your name?
PCT should identify that adjusting the patient's bed to between 60 and 90 is
High
High
Fowler.
high Fowler.
Okay, I said that.
High Fowler.
Just a
Okay.
thick bitch, I can't.
So go over your Fowler
I can't wait
positions.
to keep that part of your home.
Which of the following provides specific definitions about the scope?
Oh, I don't know this one.
I think I picked,
I think
I said the nurse practice act.
but we're not even nurses.
yeah,
HIPAA?
I did HIPAA.
I think HIPAA.
I guess you.
But like, that's like, so we don't make mistakes.
Oh,
right?
it's the nurse.
Oh, I
Yes.
get it right.
Okay,
Oh,
so
I think that one last
HIPAA
time.
tells you about what?
Patients.
Violation.
Patient information, protected health information, and insurance. Is that anything to do with you?
No.
No. Informed consent, is that anything to do with you?
No.
The PSDA?
No.
No, that's about advanced directives. You guys are working under who?
Nurses.
Under nurses, okay? So
I
the,
think
so the Texas Nurse Practice Act is the one that involves you guys, because that's what tells us what can be delegated to you and what tasks that you can receive from the nurse, okay?
Okay, that.
You are part of the nursing staff. You're a nursing assistant. Alright, prescription for anti-embolism, which of the following
Oh, I didn't know
should
this.
you
Oh,
take?
is it A?
I put, I don't know. I don't want to say what I put.
I said
I
remove
think
stockings
A.
once every 24 hours.
I said avoid rolling the stockings, especially.
Yeah.
Yeah.
But I thought that
Yeah.
cut off circulation, no?
Only because
I put instruct the patient to cross their legs.
y'all are all loud.
Oh,
That's
huh.
what I was saying. I was like, I didn't
Actually,
feel
I was
good
like, this was like, heck no. You gotta be like that? No.
No, you don't wanna cross your legs because that increases your risk for a DVT.
Okay.
The stockings don't help prevent falls because they're just like, they're like tights, right, they're slick, okay? Avoid rolling them partially down the legs. Well, I mean, how are you gonna get them off, right?
Yeah.
Like, you're gonna have to do that. We should remove them once every 24
Yay.
hours, okay? Because just think about it, like, you guys remember having to wear like those tights, you know, how great does it feel when you finally get to take them off, right?
Mm.
Remember when your parents would dress you up like for Christmas and you had to wear those stinking tights to church and all day long, right? And you took them off and it was like the best
No, I
thing
didn't wear
ever.
those. I wore boots. And now they go to church.
Same thing for like taking off your bra, right? It's the best
Oh
time of
my
the day.
gosh.
Oh,
But there's two guys in there.
Actually, yeah, I love that feeling, that wire on my back, yeah.
Now you know.
Which of the following blood specimens should a PCT keep chilled?
Ammonia.
Ammonia.
That's the only question I know I'm gonna get right.
Because bilirubin, what do we protect the bilirubin sample from?
Light.
So
Light.
that was the amber one. I got that one
That's
right
the
there.
amber one, yes, right? Because remember, okay, what causes jaundice in babies?
Yellow.
Not enough light.
Liver failure.
Liver failure. I don't know.
It is the breakdown of red blood cells. The breakdown of red blood cells, which produces bilirubin. How do we get rid of bilirubin?
I've never heard
We
that.
put them in the light,
Oh.
right?
What?
We put them under the bilirubin lights, right? You ever see those babies that are in the hood and they got the little space glasses on?
Oh, is it blue? It's a blue light?
The little blue light,
Oh
right?
my, okay.
And then after they go home and their bilirubin levels are still high, in order to bring those bilirubin levels down, we say, put your baby in the sun.
My
Okay?
grandma did something over there.
Gross.
So if your
And
baby
still
comes
birds
out
on the same
yellow,
places, like
if your baby comes out yellow, put it in the sun. Okay?
Like
John
So
does.
basically, they're like a flower.
Yeah. So if I want to get a bilirubin sample, I want to protect it from the sun. Otherwise,
Oh, breakdown.
it's going to start to break down before it gets to the lab.
Oh, that's cool.
Venus draw for a 91.
A.
I said butterfly.
I only know that because you said that last time.
Syringes are for weak.
Yes. And I
Yes.
read
So
that.
butterfly needle, right? For probably some
Hard to find.
smaller veins, and the syringe because we don't want for the vein to do what?
Collapse.
Collapse.
Because them some old veins.
Yep.
Alright, which of the following locations should a PCT place a drainage bag for an indwelling urinary
I
catheter?
said
Secure it on the
frame of the
side of the
bed.
bed.
Yeah, I said side of the bread.
Yeah, frame of the
I
bed.
said frame of the bed.
because they put it on the floor, they're gonna bust it by walking.
We're not putting it on the floor because ew, germs.
Yeah.
We're not putting it on the IV pole because that's a quick way to get it ripped out.
Mm-hmm.
Are we gonna put it on the side rail?
No,
No.
Because you're
because you can
No,
pull it
because the
down.
side rail is a movable part. We don't put it on movable parts because if it's a little bit tight and you take that side rail, you're like, here, then you're gonna pull it out. So it has to be secured to the frame of the bed or an unmovable part.
Okay, that was a good one.
Enters the room is approached by visitors requesting test results.
The doctors
Sorry,
to give you
I
that
can't give you that.
information.
Yeah, I said sorry, I can't give you that information.
Yeah.
Wrong answer, folks. Go on, yeah.
Oh,
What is which of the following responses is appropriate?
So the doctor can't give you that information.
You're gonna have to ask them.
Well, the nurse can't.
so the doctor?
Yeah, I'm sorry, but I can't give you that information.
Yeah, this one.
They're asking you.
I got it.
Sputum specimen,
First thing in the morning.
In the morning,
Girl, you thought you could play with us.
first thing in the morning.
they thought they could feel it. That's why you need to be slow and steady.
No.
Oh,
Changing
changing
linens.
linens.
Changing linens.
Yeah,
That's what I said.
Bed linen.
joking, I swear.
Stop, don't explain. We get it. We get it. Keep
Wait,
going.
what's the answer?
There's more than one bed linen. Bed linens. Because that's only clean. You don't need to sterilize that.
The rest of them are sterile.
Okay.
Right?
Yes.
Aseptic is clean.
I don't even know.
Alright, so is it inserting a urinary catheter?
No,
No,
sterile.
because it needs to be
Sterile.
sterile. What part of, what is this? Like, why for bed linens?
Because you don't need to make it sterile.
So the patient's.
It's because
You
what
think
I thought
it's
is that
like
the rest of them
normal
are sterile,
laundry.
so it has to be that one.
Okay.
Yeah.
Cleaning an operating room?
That's sterile.
That's gonna be sterile, right? Assisting to apply a sterile dressing.
Sterile.
I think it's
It
sterile,
says
but I
in the
don't know.
name.
But you're assisting.
You still would have to be sterile, no, because it has to stay sterile.
Cause what if like you mess up and then they have to start over because it's not sterile?
You're
Why you guys having
Take your L.
I know, it's funny. And so, okay, if it depends, okay, honestly on this one, it really does depend specifically on what you're trying to do. If you're just opening, packages and things like that, dropping things onto the sterile field, doesn't have to be anything, major. But if you're actually like helping to apply it, then you would have to put on sterile as well. So it is your bed linen. Which of the steps for a finger stick should PCT do first?
Confirm the correct invitation.
Identity.
Identity.
I almost picked up. Like when I was like, wait.
Report which of
Oh, I
the
don't know.
following about possible elder or abuse or neglect.
Patient who
I
reports for
see.
checking account is being managed by his adult.
Yes.
Manage.
I put the B
Mismanaged.
first and then I put C for the second time that I took this test. So I don't know.
I put C.
Man, yeah.
Yeah, because it says mismanaged. Mismanaged. So this is a type. Identify which of the following requires contact.
Influenza. No.
Yeah, I
Measles
mean,
and flu.
what is rotavirus? I was really thinking about this.
I say measles.
Isn't this one influenza? Or measles, it's measles. The other one was influenza. There's another question.
Influenza was
Droplet, airborne, contact.
What? But measles, isn't it the...
Measles is like pimples on the skin.
Measles is spread through airborne.
Oh, because scabies is too.
No, scabies is
Scabies
touch.
is
Scabies is
contact.
airborne.
Oh, oh yeah.
Alright, I'm close.
I mixed them up.
But it is an airborne.
I'll take my L.
Airborne.
Coronavirus.
That's why chickenpox is also.
Oh, sorry.
I know, I thought it was contact.
Transfer from a bed to a stretcher.
Equal height.
Same height.
A.
8.
A. Equal height. Yeah. So I have seen people, let's see, elevate the position lower than the height of the stretcher, or going from a bed to a stretcher. There have been times where people have lowered it, so like if I'm going wherever I'm going to, they make it a little bit lower, but then that's a drop, and so that's not necessarily the most appropriate.
That'll hurt them.
Right. Why do you not want to reach across?
You can snag them.
Yeah. Yeah. And we're not going to go higher because that's going
Higher.
opposite of what we want to do.
Oh, yeah.
Non-weight bearing patient from the bed to a wheelchair.
Lock the wheels.
That's so hard.
From the bed to a
Yeah.
wheelchair. I think instruct the patient to remove socks and shoes. I'm just joking.
Lock the wheels. I'm pretty anxious. This is my first time having blood drawn.
Explain the procedure.
Yeah, describe the procedure. Yeah.
Okay, no pussy. Put your arm down.
Well, it's because I don't know the procedure. It's kind of weird. Like, if you really
Like describe the procedure. So it's deep.
I'm gonna stab you.
Okay.
Yeah, I'm gonna put a needle in your vein.
Okay, get ready. 1, 2, 3.
I would just
So
Can I feel like a little?
Are we going to? Are you going to tell the patient that you're going to stab them?
No.
No. Are you going to tell them about all the things that could possibly go wrong?
No.
Are we going to do an ammonia inhalant?
No.
we could.
I mean, we could, but.
But we can't do that
Okay.
yet.
Yeah.
Suck butt, like, oh my goodness.
What is that?
VTAC.
Attack.
Recheck.
Okay,
I need to get that right then.
Long tooth or sharp teeth?
Oh, me too.
Sharp teeth.
Okay, I got that right.
Sharp teeth. Sawtooth is short. Right, they're short. This is big and scary because this is going to kill
Which one
you.
is
Isn't
sawtooth
BFib
again?
really bad too? Also, BFib is like the.
Sausage is
Atrial flutter.
What's the
Flutter.
tombstone?
Because it's 1, 2, 3, and then your QRS 1, 2, 3.
And then what is the
what is
atrial flutter, atrial.
fibrillation?
I don't mention.
What are the two again? There's two with A.
Atrial.
A flutter and AFib.
And there's ventricular
I
fib.
know, what the heck?
Oh,
No, me sweets are.
My goal for the rest of the year is to sit in that chair. Alright, AFib. What's happening?
Death.
Sawtooth. Or like it's quivering.
Oh wait, no, that's not
I don't know
death.
why.
It's quivering.
That's quivering, and it's also
Saw.
regular, irregular.
Irregular.
Irregular. Okay? So this is AFib, atrial fibrillation.
and that's the lowercase f.
Little a's. These are fib waves.
Oh.
Okay? A flutter is
Oh. Jaws.
Little wings, uppercase.
yeah.
And that one's right.
So it's regular,
But
and there is 1, 2, 3. It's in a ratio 3 to 1, 3 to 1, 3 to 1, 3 to 1.
Is it always like that?
No, it could be 4-1, 5-1, 2-1.
But usually
it's
common,
always
like
a-
regular.
It's always a ratio and it's always regular.
Okay.
Okay.
Okay, so this is a flutter with capital F.
Okay.
Okay,
So little waves is lowercase.
little waves. Little waves is little f. Bigger waves is big F. Okay. So remember I talked about the little roundabout. That little impulse is getting stuck and it's going round, and then it's going down to the ventricles. That's what that is. Okay. All right. Now we have.
You're dead.
VFib.
You're dead.
Heart attack.
VTAC.
That's a
VTAC.
Oh.
So big. Okay, so this is big. I'm in a constant state of contraction, relaxation. Okay, so it's going up and down, up and down, up and down. Okay, what's the treatment?
Shock.
Shock.
VFib.
Because 50%
Will pass out. Okay,
That's death of the heart.
right? This is complete and utter chaos. This is VFib. This is dead.
Like you're
Dead or about to die.
I mean, you're
Dead.
pretty
That's the life
already
exit. You see the
You're
light.
pretty dead.
That's dead.
Okay, no pulse, no breathing.
Didn't he say guy went in or was it VTech?
And VTAC, yeah.
Oh.
The guy that was telling me about his cruise and he just
Yeah.
Oh, what a cool guy. I hope he's alive still.
I doubt it. That's
Oh.
Oh, way to burst my bubble.
This is my 20th year for my nursing license.
You're gonna cry?
No,
This is the year today.
this is the year, and so I graduated WT in 05.
Oh my god.
I was born a year
Guys,
after.
we're gonna
I know.
ETs tomorrow.
I could be your mom.
Let's pray.
Stop. No, shut up. Don't say that.
I'm excited.
All right, which of the following reduces abnormal marks?
Let's make it the name.
Artifact filter.
I say artifact.
So I was right. Oh my god.
Yeah. I'm such a go.
Ah, there it is.
Here it is.
Take a deep breath and exhale through the tube for 10
Six,
seconds. That's the one I chose.
That would be wrong.
What?
I
Ouch.
chose C.
I guess it's
Oh, yeah.
the long tube to
See how it says like raise the balls? This is like just going straight
Take
up.
a deep breath. Exhale through the long tube for 10 seconds. That's what I picked.
I think I picked
But we
D.
don't breathe into it. We're not exhaling. We're breathing in.
Really?
So it's
Think
B.
about it as a baby.
Oh yeah. Okay. Yeah.
So it's B. Or it's
That's
C.
fine.
So
Incentive. The air's going in.
we're not lying flat.
Aye.
We're not exhaling. And we are not
Breathing
breathing
into it.
into the chamber. So the only one is this one. Even though
It says
I don't
forcefully.
care for the way that reads.
I don't like the way forcefully.
Yeah. But the other ones are not the correct technique.
Yeah, because I thought it was that, but it's just the way it says that. That's weird.
I said D.
I said D. Ordered.
Oh wait.
Yeah.
It's always the order.
It
Yeah,
depends on the
that's it.
order.
Has ordered. Yeah.
Oh,
Oh, it's the right in here.
What I do?
Find the light turn on.
Because she walked in.
I'm hungry.
Yeah.
One thing's gonna die.
That's why I put right down.
I have my charger in my.
You can get enough for it.
So there'll be some stuff that we still have to finish and take care of afterwards. But I'm gonna get this part of the
I know.
Let me know.
She's studying it. I think she's alright.
You're busy, Miss
Over
Winter.
60.
Isn't that the
That's
D? 30 over 81? 130 over 81?
Because the average is 120 over 80.
Oh, it should be D, shouldn't it?
D is only one
It's
point
somewhat
over the
high.
average.
What you should be for.
I said D.
I said D.
I said B.
I said B for this, but I think it's D.
I said B.
Yeah,
I think it's for low.
somebody asked me about this one. And when I saw this question, I don't like any of them.
Yeah.
I'm going with D.
Yay.
The
Because-
reason is because this would be like,
Too hot.
well, it's not too high.
No.
But according to the guidelines that AHA has put out for hypertension, this is hypertensive. This is like
Like a
stage
big-
one hypertension.
And the other one is
So
like
is
low bits.
hypertension worse than hypotension?
Yeah.
I wouldn't say that either is worse,
Oh.
but they are both reportable. So hypotension, what's the problem with hypotension?
It's low.
Well, yeah, it's low, but what's your patient gonna look like?
Like about to pass out.
Tired.
It depends on how low,
Peevish.
right? They could have signs and symptoms or they could not. At 98/60, I mean, they're probably okay, right?
Also, isn't that kind of normal though for like athletes or something too? It having really low.
Yeah, and that
So
one's
awkward.
fine. But hypertensive, what's that patient gonna look like?
Like
Red.
They're probably
Tired.
probably gonna be fine. They're gonna look just fine. Okay, probably some of us are sitting in here with the 130/81. Let me finish this coffee and then we'll talk. But 130/81 over an extended period of time can cause damage to your vessels and all that sort of stuff. So, if I was gonna report one, I guess it would be 130/81.
So wouldn't that technically be called elevated? So like
Yeah, I can't remember where the cutoff numbers are. I know because 120, or I think it's greater than 125 now is listed as is elevated
I think so.
before it gets to hypertension 1. I have to look that up.
I just think of medical math. That's why.
Yeah, we learned
Yeah.
this stuff.
Did you paint your wall black?
Me?
No, they have
They
a black
actually do
one.
sell a black one.
Yeah.
Oh, here's your one.
My mommy has that.
Yes.
I have a green one.
Yeah.
Oh,
Yeah,
see?
that one.
That one.
Superman with hands over. I always pick.
I guess it's supposed to fold a
I
towel
put
under
it
the
on
damn
under
head.
the head.
Because if you remove the dentures, then there's like basically
Yeah.
like stuck in weird.
So this one doesn't have the option of removing or cutting them.
That's weird, huh?
Place the bodies, okay, we know it's not this one. No one cares about the day pictures.
Colin is right. It should be.
Yes, I would leave the dentures in, otherwise the cheeks are gonna sink.
Yeah.
See? You're stuck in weird.
I have a pair of. They look like.
I'm gonna go to this one because
No, it makes me too.
I'm going this one because this one makes the most
I
sense.
picked that one
But Miss
too.
Switcher's also a nurse. We're PCD.
Because the way you guys were telling me, it's like you had both options as to remove them or to cut them. But either way, it doesn't say what we're going for an autopsy. So technically, this one would be it.
Yay.
Okay.
Don't
We'll
be
have
silly.
tomorrow.
That's pressure. Pressure.
Oh yeah, this one's applying pressure.
Yeah.
Okay, so since we're getting down to the last little bit, okay. Tomorrow, be here at regular time. You don't have to come